With more doctors retiring and more rural patients struggling to find good health care, the medical community is starting to shift its focus as well.
As they get older out here in West Texas, particularly up here in the Panhandle, they become less mobile. They don't have cars to get around, and so it's more difficult for them to get in. It's also then more difficult for their families because their families have to take time off to go get mom and dad to take them in to see the doctor.
As we mentioned in the last part of our series, the Texas Tech University Health Sciences Center is looking more at the medical problems facing the rural population, and they believe catching these problems before they become chronic will not only stretch health care, it can make rural care more manageable.
Because if you look at our problems here, they're the same as they have in the Dakotas, they're the same as they have in rural Oklahoma, they're the same as they have in Wyoming, and so what we need is very different than what you might need in Austin or Dallas or Houston.
Blood pressure, heart problems, and obesity are some of the top medical problems in rural settings. And addressing the medical conditions and not just throwing money at the problem is the focus of Mitchell.
We need to, rather than just going to Austin or going to Washington and say, give us money to figure this thing out, that's not the approach we need to take. We are responsible, we should be responsible for going to them with solutions.
And being able to address those problems and offer medical services in more outlying areas is the focus of rural hospitals like Golden Plains and Borger.
Because for one thing, the technology that has come along with the laparoscopic surgery and things like that, things are being done in a smaller setting that never would have thought of done before. 60% of the revenue and activity is outpatient. We really need to talk about that more. That's really where the drive has come.
Steve Myers, Pro News 7.